Hi, everyone. Welcome to our April KBH Plus implementation community, hosted in partnership with the Child Bright Network. We're very excited to have you all here today. Before getting into things, I'm just going to give it a little bit more time as people join us. But would encourage you as you're joining, if you're comfortable, sharing a little bit about yourself and where you're located in the chat, just so that our presenters today can get a sense of where people are coming from. All right. So let's get started. It's always an awkward silence as we wait for people to join. But we'll kick things off because we have a pretty packed and exciting agenda today. So we're very lucky to be joined today by the Advanced Network Fellows, who I will let introduce themselves once we get to their presentations. So we have Laura, Megan, Sarah, and Brittany. And as I mentioned, our implementation community webinars are hosted and in partnership with the Child Bright Network. So thank you to both KBH Plus and Child Bright for helping to bring this all together. So prior to getting started, I want to take a moment to acknowledge and give gratitude to the lands in which we all have the privilege to grow, connect, learn, and do our different implementation and neurodisability work. So my name is Vanessa, and I have the privilege of being the KBH Plus implementation community facilitator. I also have the privilege of being a CanChild postdoctoral researcher, and CanChild is located at McMaster University, which is the traditional territories of the Mississauga and Haudenosaunee Nations, protected under the Dish with One Spoon Wampum Agreement, which represents an agreement for sharing and a joint responsibility for care. And we can think about that in terms of our land as well as society. As acknowledging that the networks here today are national in scope and reach, we give gratitude to the many lands and acknowledge the traditional territories that our networks work and operate on. So I see people introducing themselves in the chat. Thank you so much. And if you're comfortable sharing your locationality as well, please do so. And if you're unsure, we've included a link at the bottom there for you to explore. Recognizing that land reflections and acknowledgements should always be coupled with action, I've included a resource on the slide here today that I've recently started reading. I don't know if others here today have read this. It came highly recommended, and I'm already finding it very insightful and practical. So I'd encourage us to all think about, in addition to our locationality, thinking about some actions we can also do, whether that's related to knowledge and education, or the work that you do connected to KBH Plus, Child Bright, and beyond. So KBH's implementation community. So for some of you who've been to the webinars, you've seen this slide before. But our community includes both these public webinars as well as smaller, what we call community chats, that include KBH-funded projects, both past and present, to come together. And really the goal of this community is to build connection and capacity in the neurodisability field and implementation science, as well as to advance implementation science in the neurodisability field. If you'd like to learn more, you can check out our webpage. There's a QR code on the slide here. And the webpage also includes past webinar recordings for you to check out. And welcome to those who are joining now and trickling in. So KBH Plus represents three main entities. First being the KBH Innovation Fund, which helps to catalyze the private sector by building commercialization pathways that help to support and fund different neurodisability startups, projects, and initiatives. We then have the KBH Network, which is funded by the government and aims to help drive impact, innovation, and scale up. And then, of course, the KBH Foundation, which is really powered through philanthropy to help increase reach and access of the different evidence-based and proven solutions nationally. And this work could not be possible without the many partners, including ChildRight. So again, thank you for your partnership on these webinars. And speaking of ChildRight, I'll pass it to you, Audrey.
Thank you so much. My name is Audrey Wippenhorst, and I'm the co-chair of the Training and Capacity Committee at ChildRight, which is another network. We do a lot of work in pediatric brain-based disabilities. So I have the privilege of chairing an important committee. We look at funding around summer students, postdoctoral researchers, and a number of other things. And I also come to this work as a parent. My son had a stroke when he was 5, and he has an AVM in his brain, so he has trouble using his left side. So certainly I was really interested in today's topic because I've been knee deep in lots of different policies around access to disability funding and things like that. And there's lots and lots of room for improvement. So look forward to hearing from the guests this afternoon. Thank you for having me.
Thanks, Audrey. So during today's webinar, very quickly, and many of you are already using the chat, so I don't have to direct you towards that. So you can include your comments, reflections in the chat. There's also a question and answer function. And then if you'd like to request to be unmuted, you can raise your hand and then I can do that for you. So in a commitment to want to better understand and equitably engage our members and the broader community who attend these webinars, we just have 2 quick questions for everyone in attendance today that I will just pull up right now. And so the first question is asking, to the extent that you're comfortable sharing, it's all anonymous, your particular identities that you would like to share with us. And then the second is about knowledge on this webinar topic. And so when we think about this webinar in particular, I think we can think about that connection between disability policy and implementation. And so maybe commenting a little bit about or indicating your perceived level of knowledge related to that. And I'll give everyone a few moments to do so. Okay. And I won't publicly share the results, but just for our presenters, most people have highlighted that they are somewhat knowledgeable. We have a few not at all knowledgeable, neutral, 1 extremely knowledgeable, and 2 who feel knowledgeable, but majority are in that somewhat knowledgeable. Okay. I think that is great. So I will end the poll. In 1 moment. Okay. Thank you, everyone. All right. So now I'm going to pass it over to Brittany.
Thank you so much, Vanessa. Thank you to Vanessa and KBH Plus and ChildRight for having us here today. We're so excited. So my name is Brittany Finley. I'm the research program manager of the Disability Policy Research Program, which is at the University of Calgary. And I've been doing a lot of the operations and management coordination of the Advanced Network, which we'll talk a little bit more about today. So our main event really is going to be the Advanced Fellows, but I'm going to kick things off just by providing a little bit of context about the network, to set the stage and also just make sure that everyone's aware of this initiative, the work that we've done to date, before passing it off to the advanced fellows. Vanessa, you can advance. Thank you. So I know Vanessa already did a land acknowledgement, but I wanted to take the time to do one as well, just in recognition of the land that I am calling in from today. I've seen a number of people adding their own land acknowledgements into the chat, so I'll invite you to continue to reflect on that as I chat about where I'm calling in from. So with gratitude, mutual respect, and reciprocity, we acknowledge the ancestral home culture and oral teachings of the Treaty 7 signatories, which includes the Blackfoot Confederacy, comprised of the Siksika, Pikainai, and Kainai First Nations, the Tsuut'ina First Nation, and the Stoney Nakoda, including the Chiniki, Bearspaw, and Good Stoney First Nations. The city of Calgary is also homeland to the Métis Nation of Alberta, Districts 5 and 6. So the Nose Hill Métis District 5 and the Elbow Métis District 6. As a personal reflection, something I was thinking about while I was preparing for this and thinking about the implementation and the community aspect of this webinar is really just to acknowledge and reflect on the importance that Indigenous peoples hold with respect to storytelling. And it really reminds me of the importance of listening to stories and holding stories as a sacred form of knowledge. So I think the work that we're doing here in the Advanced Network and with the Advanced Fellows, it needs to be and is fundamentally built on listening to stories and trying to make changes in accordance with what we hear. So for me, these moments of reflection of the land that we work and play on serve as, both a moment of gratitude for really the example provided to us by Indigenous peoples and a reminder to continue listening and acting in alignment with what we hear on our path towards truth and reconciliation in this disability policy space. And next slide, Vanessa. Okay. So like I said, the advanced fellows we have on the call today are really the main event. But before we get into their thoughts and insights, I wanted to provide some information about the broader Advanced Network Initiative to provide some key context for their discussion. So the three individuals presenting today, and I will note we do have a fourth fellow that was unable to attend today for personal reasons, but they are fellows with a newly established initiative that is jointly run by a leadership team, kind of large or partially housed in the University of Calgary, and by our lead partner, Kids Brain Health Network, called the Advanced Network. So while we're in our early phases, this network has brought together community partners from across Canada, as well as research and individuals with lived and living experience, including our Parent and Caregiver Advisory Council, with the aim of improving the design, delivery, and equitable access to disability programs for youth and their families across Canada through co-designed research and knowledge mobilization. Next slide, Vanessa. Thank you. The research we are going to be doing as a network is led by our advanced fellows. This is our inaugural cohort of fellows, and we'll be recruiting on a rolling basis throughout the project. The fellows had the mandate of supporting network leadership in establishing the core areas of focus for the network and pursuing individual research projects in each of those areas of focus using cross-Canada data they have been compiling since they began their fellowship in June of 2025. So for some key context, as a network, we hosted a strategic planning session in October 2025, where all of our network members, so that includes our community partners, our parent and caregiver advisors, as well as academics and other folks associated with the network, we really came together and we wanted to come up with a consensus on our 4 core areas of focus for our network as a whole. We also distributed surveys before and after to make sure that we captured perspectives of individuals that maybe were not able to attend or didn't feel comfortable participating during the event, just to make sure that the areas that we landed on resonated with everyone's perspectives and experiences as best we could. So the result of these discussions allowed us to develop 4 core areas of focus for the Advanced Network, which we have listed on the slide here. The first being program types and governmental efficiency. So looking at the different programs that support youth with disabilities and their family. Access trajectory, so understanding how access is experienced across the life course and at those key transition moments between entering school and entering the workforce. Eligibility and design, so how disability programs are designed and how they differ across Canada. And then access and exclusion, so who is and is not accessing programs and why. Vanessa, next slide, please. Thank you. So based on feedback from our leadership team, from our partners, and from some of our parent advisors, we added in an Indigenous parallel path stream to the Advanced Network this year. This is under the leadership of Dr. Grant Bruno and is in partnership with the KBHN Indigenous Advisory Circle. So having this stream as a distinct parallel path allows the research to proceed in a way that is Indigenous owned and led, with outputs that are owned and shared by and for that community, while also allowing for shared learning moments across the 4 core areas of focus. To support work on this initiative, we have just recently onboarded an Indigenous Policy Fellow, Sarah Spence, that will be spearheading the work in partnership with Grant Bruno as well as the Indigenous Advisory Circle to be done in the stream. So they're just getting started on that project, and we're really excited to hear more from them at a later date. But we wanted to let you know that this is an initiative that we're really excited about and really proud to move forward. So yeah, today we're going to talk about the research that has been led by this cohort of advanced fellows, with each completing a project related to one of the 4 core focus areas that are on the slide here. To support them in their projects, each fellow has been working with 2 mentors in the advanced leadership team, which consists of both academics as well as individuals with lived and living experience. And a working group, which consists of community partners, academics, and family research partners that have been able to provide input and feedback to shape the direction of these projects. So with all of that context, I will move into the reason we're all here, which is to hear from our incredible fellows and learn about not only their projects, but their insights with respect to working with community and that kind of implementation side of things. So we are going to go around. We're kind of going to structure this instead of having a formal presentation from each of the fellows. I'm going to ask them each these 2 questions. We'll start with question 1, go through all 3 fellows, and then go to question 2. And they'll be able to chat about their experiences in each of those areas. So we thought it would be good to start with the fellows providing an overview of their experience in the area of disability policy and the lens that they bring to their work. So we wanted to do this in recognition that there are a lot of different perspectives and experience that shape the work that each of the fellows are doing. We thought it would be a great way also for the fellows to not only introduce themselves and their experience, but also a little bit about them and kind of the lens that they bring to their work. So I will move now to, we can go Laura first. You're on the top of my screen. If you could provide us with an answer to the first question.
Yes. Thank you, Brittany. Is my audio okay?
Yeah.
Great. Thank you for taking the time to attend this webinar today. My name is Laura. My preferred pronouns are she, her. And I had briefly introduced myself in the chat, but I'm indebted to working, living, and playing when it's not snowing in Treaty 6 and Métis Region 2. I recently moved here, so the snow in April is a new experience for me. I previously was lucky to live and work in the Okanagan, where I worked in disability policy under the guidance of Dr. Rochelle Hole and looked at especially transitioning from child services into adult services, roughly around the age of 18. And from that space, I was lucky to become one of the first iteration or round of fellows to join the Advanced Network. And I bring to that role both personal experience. I identify as neurodiverse, and I also have a academic background where I've always gone against the grain a little bit, trying to do interdisciplinary work when sometimes in these worlds, people like to think really siloed. And I think the work that Advance is allowing us to do similarly is sometimes going a bit against the grain and trying to improve that access and inclusivity. In line with that, I am specifically in the fourth theme that was on the previous slide. And so access and exclusion was the main theme. And my question that I'm looking at with the work group is specifically who is falling through the cracks or who is missed. And so I'm excited to chat about that a little bit more today. Thank you.
Thank you so much, Laura. We'll move on to Sarah now.
Thanks, Brittany, and thanks everyone for joining the webinar today. Just a little bit about my experience in disability policy and the lens I bring. So my experience is really shaped by a dual perspective, both scientific research and policy work. And I think that's really allowed me to think about how evidence and research translate into real world systems. I have a PhD in medical sciences with a specialization in pediatrics, and I currently work as a research associate at the Children's Hospital of Eastern Ontario. And my work there really focuses on the early identification, diagnosis, and intervention for children with neurodevelopmental disabilities. And then, so through this work, I can really see how policy decisions or potentially gaps in policy show up in the everyday experiences of families who are navigating care, supports, and services. So in addition to working at CHEO, I also am a policy analyst with Employment and Social Development Canada. So I really focus on the implementation of the Accessible Canada Act. So essentially, I use disability evidence and research to inform policy decisions and supporting accessibility being embedded into federal programs and services. So in a nutshell, the lens I bring to this work is very much grounded in evidence-based policymaking with a strong emphasis on implementation. So I'm really less interested in how policies exist on paper, but more so how systems are structured, who holds responsibility, and whether those systems are actually working for persons with disabilities. So in a nutshell, I think my approach to this advanced fellowship is about how we can bridge research and policy to create systems that are more inclusive, coherent, and very inclusive in practice. So that's just a little bit about me. Thanks.
Thank you so much, Sarah. And we'll move on now to Megan.
Great. Thank you so much for the opportunity to speak today. My name is Megan Reitzel. I'm a postdoctoral fellow with the School of Public Policy at the University of Calgary and the School of Rehabilitation, Science and Canchild at McMaster University in Ontario. And I'm supervised by Drs. Jennifer Zwicker and Michelle Phoenix. So my positionality around disability policy work is shaped both by my clinical and my research experiences. So I'm an occupational therapist with 9 years of experience working in publicly funded children's rehabilitation in Ontario, where I supported families navigating disability programs and really had the opportunity to see firsthand how the diagnostic-driven and deficit-focused eligibility and assessment processes often created what felt like unnecessary barriers for youth and caregivers to get connected with these supports. And really witnessing these challenges is what drives my commitment to advancing more equitable disability policy across Canada. So I'm currently, in addition to the advanced work, engaged in research that's using a community engaged and co-design approach to advance eligibility criteria and service design practices within government disability programs and services, with the goal of hoping that services could better reflect the lived functional needs of children with disabilities and their families. So really, the lens that I bring to disability policy is grounded in three core values. The first is that I feel really strongly that policy needs to be informed by the people most affected by it. Second, that equity needs to be a starting point and not an afterthought in designing disability supports. And finally, that meaningful policy change requires collaborative action across provinces, territories, sectors, and communities. So thank you for having me. I'm connected to the design and eligibility core area, and so I'll be speaking about that when we talk more specifically about our projects.
Great. Thank you so much, Megan. And I just wanted to take a quick moment to read out for our fourth advanced fellow who couldn't make it today. I just thought I'd read out her bio just so you could understand what she's doing, what work she's working on. And if you want to learn more from her or connect with her, I think we'll put my email up at the end of the slide, so I can certainly put you in touch. But just want to make sure that she's reflected in this conversation. She's also doing a lot of great work. So our fourth advanced fellow is Kelsey Seguin. She's a PhD student at the University of Ottawa in the field of rehabilitation sciences. And her research explores how children with cerebral palsy feel and move through space using photo voice and walk and talk tours. As an advanced network fellow, Kelsey is analyzing wait times across Canada's core disability programs for children. And Kelsey is also a council member for Child Bright's National Youth Advisory Council. And she wanted me to note that as a researcher with cerebral palsy, Kelsey brings a unique perspective to the field of disability studies. So just wanted to make sure that her work was acknowledged. She's doing a lot of great work as well. And now we'll move into the second question, really the meat of the presentation today. So fellows, could you each provide a summary of the work you've been completing with the focus area working groups and a consideration for policy-oriented implementation of the project outputs? So we'll go back in the same order and start with Laura.
Thank you. Yes, and so within the fourth theme that was on the slides previously about access and in an exclusion, I met with my working group and started off our project zooming in a little bit more on specifically early childhood intervention and disability support, just because of the limitations. I only have a year, and so we had to pick one of the specific focus areas to really be able to dive in. And so thinking about early intervention and disability supports really refers to those supports people might need from the birth to age 5 period. And specifically in this focus area and in collaboration with the working group that consists of 6 members, we identified that a good way to map who is missed, which is sometimes hard to do, to actually map who is missed, because sometimes that's where there is gap in knowledge, there might not be data. And so we actually decided to, apart from me collecting available data, co-produce an output document with visuals speaking from each member's personal experience, lived and living experience, because 3 out of the 6 members are parents and caregivers and have actively had to navigate these disability supports, ages 0 to 5. And so our work will really be around not just providing data and numbers, it will also be about allowing each of those perspectives to shine through in a personal connection. So rather than talking about how systems might not communicate with each other, say health and disability supports, we're talking more from that direct experience. So when you are a parent, what happens when those systems are not communicating, and how do you then move forward? How do you maybe access other alternative community supports to really make it come to life a little bit more, rather than talking about these experiences top down? And the consideration there, specifically for policy, is to not talk about only the academic evidence, but to actually talk about those lived and living experiences by parents and caregivers as a form of knowledge that should be central to future policy and implementation, and also to sometimes go against that idea that people's experiences are unique or an exception to the rule, when actually often we see that there's a lot more similarities across people's experiences, especially when having to navigate intersectional barriers, meeting overlapping systems or realities that make access even more complicated. So, for instance, people from Indigenous backgrounds in Indigenous communities, people from immigrant communities or refugee communities, but also those living more rural or remote, and those children and families having to navigate not just disability related needs, but also maybe complex needs associated with health. And so I hope and I'm pretty confident that the project outputs will help inform that consideration of who is missed and in what way do people experience that being missed. Thank you.
Fantastic. Thank you, Laura. We'll move on to Sarah now.
Thanks, Brittany. So the theme that I'm working on for my advanced project is on the government services and programs and the efficiency across these provinces and territories. So when I think about the project when I initially was starting, was the main question that I really wanted to ask is, how are disability services and programs for young children organized across provinces and territories? And what does that organization mean in practice for families that are trying to access that support? And so after much research and discussion with some of my advanced mentors, as well as the working group and breakout groups, I'm really focusing on the early years from birth to school entry, because I think that this is a really critical developmental period, but it's also when families tend to experience the most confusion. So we know that while supports do exist, families often struggle to understand where to go and who is responsible and what will change, especially as their child grows up. So at a practical level, my project is basically, it involves mapping where early childhood and developmental disability services sit within provincial and territorial governments. We know that a lot of these programs and services are spread across multiple systems, so like health, education, childcare, social services. And we often find that many of those programs fall under different ministries in our provincial and territorial governments. And so as a result, we find that families aren't navigating one easy pathway, they're moving across several different systems at once. And I think that this becomes really complicated during transition periods, particularly when children are going from preschool and early childcare to entering kindergarten or even grade 1. So we know that responsibilities can shift, eligibility rules can change, and families are often required to reapply for different programs or even just access to the same ones. And in some cases, we know this can lead to service gaps, and it just creates a lot of uncertainty for families who really need stability, especially during that early time. And so the main goal, again, in a nutshell, of my advanced project is to make those structures visible across provinces and territories. So rather than us expecting families to piece together how systems work, my project will really focus on who is responsible for what, how do these systems and ministries connect, and where those connections actually can break down. So working with my advanced mentors and my working group, they've been playing a really important role in shaping this work. I've had some initial discussions and even including with individuals with lived experience, and a clear and consistent message has come across. We know that the disability support system in Canada is quite fragmented and really hard to navigate. As I mentioned before, families are dealing with different ministries, different eligibility rules, and just unclear entry points, and they're expected to kind of navigate that on their own. Also, in some of our discussions, we've talked about whether current structures are actually serving families well, where fragmentation is built into the systems themselves, and what better coordination between provinces and territories could realistically look like. So in speaking with some persons with living experience, they've often talked about how overwhelming the system can be, how long access and just registration for programs can take, and families don't really know how this will change, especially as their kids approach different transitions in their lifetime. And so just taking all this feedback into consideration, that we're approaching this work, it's shaping definitely how the project is coming together. And what I hope to learn from this work and create are visual map systems or pathways that show how early childhood disability services and programs are organized across different jurisdictions and provinces and territories, which ministries are involved, and how transitions can be handled. And I think developing some sort of mapping system and pathway, these are the type of tools that we can use in policy conversations. They can give policymakers, for example, a really clear reference point to identify where coordination is breaking down and where responsibilities shifts, that are creating these barriers for family. And then from there, again, this is establishing just a baseline, but from there, we're hoping that this work can translate into more policy-oriented recommendations that are focused on that implementation piece. So, for example, we could develop options to improve coordination across ministries within different provinces and territories, or we can make entry points easier for families. We can also start discussions about care coordination, or if we have a one entry point or navigation model, so we can streamline these transitions for families. So all of that to say, I think the overall goal is not to just explain how the systems work across different provinces and territories, but to create a tool that can support action by making this complex process more visible and concrete. I think that it's a first step to help policymakers identify where change is possible and shifting that burden that families are experiencing through these fragmented government systems. Thanks, Brittany.
Fantastic. Thanks so much, Sarah. And we'll move on now to Megan.
Great. Thanks so much. I get so excited when I hear about my fellows share their work as well. So my focus area was exploring how disability is defined and how those definitions can shape eligibility for government income support programs, looking at ages 0 to 25. And this is a bit of a critical issue because Canada right now does not have a unified definition of disability. And so each province and territory uses its own criteria to determine who qualifies for supports, which can create inconsistencies and inequities across the country. So the project that I'm helping to facilitate alongside a working group focuses on comparing how disability is defined across provincial and territorial disability income support programs and assessing how these definitions align with the United Nations Convention on the Rights of Persons with Disabilities, or the UNCRPD. Canada is a signatory to the UNCRPD, which defines disability, emphasizing the interaction between impairments and environmental barriers, and not just a medical diagnosis. But yet, most provincial and territorial programs still utilize definitions that are rooted in more of a medical model requiring proof of diagnosis rather than considering functional abilities or environmental barriers. So really, we're hoping to generate a report that can answer 3 questions. So the first is, how do definitions of disability differ across provinces and territories for disability income support programs? To what extent do these definitions align or misalign with the UNCRPD? And what are the implications of these definitions for eligibility and access, particularly for children and youth with disabilities? So what did we do to address these questions? Well, we conducted a comparative review of disability definitions used by 23 income support programs across all Canadian provinces and territories. And definitions were examined to assess how the language choices within those definitions shape access to supports, perpetuates impairment-focused understandings of disability, and identifies opportunity for reform aligned with UNCRPD principles. And so in terms of what we found, I don't know that it will be surprising, but 22 of the 23 programs did rely on narrow, impairment-focused and deficit-driven definitions of disability that really don't adequately reflect the lived realities and contextual needs of children and youth with disabilities, as well as their families. Alignment with the UNCRPD was weak, with only one program within our sample adopting a rights-based definition. And really, the findings indicate that definitions act as a starting point for policy, shaping who qualifies for support and whether policies prioritize gatekeeping or are more inclusive. So when we think a little bit more about comparing Canada's provincial and territorial definitions of disability to the UNCRPD definition, like we'd said, the UNCRPD definition really emphasizes an interaction between individual experiences with disability, such as impairment, and the disabling barriers in the environmental context in which individuals live. And by comparison, definitions used by Canadian disability income support programs place an emphasis on very individual level of impairment without consideration for those contextual factors. So summarizing a bit with where we're at, in Canada, we're working with definitions that are fragmented across jurisdictions, inconsistent in application, and most often rooted in a deficit-based or impairment-focused thinking around disability. So these definitions, intentionally or not, position disability as a static and individual problem rather than a dynamic interaction between the person and their environmental context. So really, the definitions don't align with the rights-based framework outlined in the UN CRPD. So the working group is still formulating some recommendations or perhaps calls to action that we're looking to frame out of this report, but we're thinking that this work highlights the need for a harmonized or broader Canada-wide definition of disability that reflects a human rights lens and is grounded in the interaction between individual experiences and environmental barriers. Additionally, to align more closely with the UN CRPD, it is important to ensure that children and youth with disabilities and their families are not just the subjects of these policies, but are active participants in shaping it, their perspectives and their lived experiences, and also the right to express themselves needs to be meaningfully included in the development of a definition that is claiming to represent them. And finally, we're identifying a need to invest in awareness and education. So those who design, regulate, and administer disability income support programs really should be equipped to understand disability in this interactive, dynamic, and contextual way. And they need to understand the harms of stigma, the consequences of language that potentially reduces people to deficits rather than recognizing their full greatness and humanity. So when we're thinking about considerations for policy or oriented implementation, really what stood out to us is that sometimes there's a benefit in bringing it back to basics and getting everybody on the same page. So we know that system level change is hard, particularly if decision makers are operating from different knowledge bases, experiences, and priorities. So communicating some foundational information about how definitions of disability impacts access to benefits and influences how we as society perceive our group's kind of deservingness of benefits may serve as like a really important starting point to have change-oriented conversation from a place of shared understanding. So I'll pause there as a summary for the work our group has been completing.
Fantastic. Thank you so much to Megan and as well Sarah and Laura for those reflections. I think it's just really interesting to see all the different work that you're doing, hear about how you're engaging and kind of what those outputs are going to look like. I do have Kelsey's speaking notes here, so I was going to provide a little bit of information about her working group. And please feel free to reach out to me at the end of the my speaking. I will put my email in the chat, and if you want to connect with her further, please let me know. But I have here, so in consultation with her working group, she conducted a jurisdictional scan of childhood disability services across Canadian provinces and territories, focusing specifically on wait times and access to services. So her goal was to understand not just how long families are waiting, but where and why these delays occur across our system. There were four main findings from her analysis. The first, that wait times occur at multiple points along the service pathway. So families are facing delays not only when accessing services, but also earlier, such as during referral, diagnostic assessment, eligibility determination, and funding approval. The second finding was that programs that require a formal diagnosis before accessing services usually have longer initial wait times. So this is often because of limited diagnostic capacity and dependence on specialists. The third, even after diagnosis or eligibility approval, families often face ongoing delays. These are caused by administrative procedures, case coordination issues, and challenges in accessing available service providers. And then the fourth being the design of provincial system affects where wait times happen. So for example, in funding-based system, delays often happen after approval, whereas in diagnosis-based systems, the delays happen earlier in the process. She did find that across jurisdictions, there are several system level factors that are consistently shaping wait times, referral and entry requirements, limited diagnostic capacity due to specialist shortages, workforce constraints, including shortages of therapists and support workers, service availability, system complexity, and funding structures. And these factors show that wait times are not caused by a single issue, but how systems are structured. So from a policy perspective, she wanted me to share that these findings suggest that reducing wait times requires system level approaches rather than isolated program changes. And overall, the findings highlight that the importance of designing systems that support earlier access and reduce fragmentation across the service pathway. So improving access to childhood disability services requires a shift from focusing on individual program waitlists to understanding how delays accumulate across the entire system. So that's just a taste. If you want to learn more, like I said, I'll pop my email in the chat and please feel free to reach out. And then Vanessa, could we just put up that last slide of mine just so I could kind of wrap this portion up and then we can move into some Q&A.
Yes, absolutely.
Thank you. Perfect. Yeah. So again, thank you to all the fellows. Like I said, they were the main event. They're the one that's been doing the great work. But kind of to, bring this back into the Advance Initiative, I just wanted to share a little bit about our implementation and knowledge mobilization plan, kind of in the spirit of this webinar. So we're really planning to position Advance to be able to effectively share knowledge and try to influence both policy and practice. Since this network is in its early stages, some of these ideas and initiatives are not fully operational, but I wanted to give you a taste of where we're headed so you can see how we're thinking about knowledge mobilization and implementation beyond the research, and including the research that is being done by the fellows. So the first being, as the fellows have shared, our approach to this work is grounded in co-design, so making sure findings are grounded in lived experience, and then the outputs that are created are practical, responsive to actual needs, and ready to be used by the intended audiences. We also, as I said, with our Indigenous parallel path, those outputs are Indigenous owned, ensuring that everything developed in that pathway is owned by community and it's shared in accordance to their needs and preferences, and guided by OCAP. The other kind of moving towards the more knowledge mobilization side, because we're bringing in community partners from across Canada that are actively involved in the work, we want to be able to, we can leverage the knowledge sharing capacities that they already have to help us share the work of the network and allow it to make real change. So because we're trying to create outputs with community for community, we hope that they'll be able to use that in a practical way in their own organizations. We plan to create an affiliated decision-making body with this network. So it would be a council of decision makers comprising of senior public sector leaders. And the plan is to have this body be affiliated with the network so we're able to keep them up to speed on what we're working on, while allowing them to give insights on policy windows or priorities that we can link our work to ensure it has impact at that policymaking level. We also plan to host webinars for this group so they can learn about inclusive policymaking. And by creating the bi-directional knowledge sharing and keeping them informed of the work in the earlier stages, we hope to establish a relationship and a trust that will allow our findings to have a more direct path to influencing policy and practice. The other two main outputs we have or planning to create is a knowledge sharing hub and forums. So we'd like to have an accessible online platform to host all of these outputs and allow users to interact with the information. And then we'll, in later years, once we've been doing this for a couple of years, we plan to host knowledge sharing forums to allow us to continue to share the knowledge we have generated. And finally, this network really is going to be the foundation for a pan-Canadian community of practice. And that'll allow the findings and the outputs to continue to be shared, to facilitate peer learning, and to get feedback on the outputs to ensure they can evolve and respond to the changing context and community needs. So that's it for me and the fellows. Maybe I'll pass it back to Vanessa, and we're happy to take any questions. And I'll put like I said, I'll put my email in the chat. And if there's anything you want to talk about outside of this webinar, I'm happy to meet and discuss. But thank you to Vanessa and KBH Plus for having us. Also, thank you to KBHN for partnering with us on the Advanced Network. And thank you to all of you for coming today and listening to us.
Perfect. Thank you so much. Brittany, Megan, Sarah, Laura, really appreciate you being here today and taking the time to share a little bit about your experiences as advanced fellows and some of the incredible work that you're doing. And hearing you talk, I kind of was taking notes and reflecting, and I heard a few things. One, of course, the gaps within our system, but the importance of identifying and grounding this work in equity, centering lived and living experiences, the importance of collaboration with individual people, but also organizations across sectors, and really the goal of more integrated, continuous, strengths-based, holistic approaches to how we do this work and our services and our delivery models. So thank you. I have a question that I might start to kick off. Let me just take a look in the chat. And I apologize. I don't know why if the slide was glitching on your end. I apologize. I don't know why. It could be my incredibly old laptop, which could be the culprit. But hopefully you could still see that okay for the most part. So the first question I wanted to pose, and I hear you, and I think a lot of us, when we think about policy or systems level change, is kind of like, where do I start? This is so overwhelming. It's so complex. It's going to take a really long time. And I'm constantly reminded, and this is a very simplistic view, and I know that, but thinking that, systems are made of people. And if you were to think about those outputs, and I know it sounds like some of you have those outputs, some are still being co-created, but if you think about outputs, who would be the key people right away, once kind of this is off the ground, that you would want to connect with to help either bridge those gaps, build those connections, or increase some of that knowledge and awareness around some of the work that you're doing to illustrate its importance, but then hopefully move towards that interest and motivation to engage.
Does anyone want to take that question?
Sorry, Vanessa, could you perhaps repeat the question one more time for me?
Yeah, no, I'm just thinking about, you have identified all of these fantastic implementation and knowledge mobilization kind of next steps. And I'm wondering from a very practical perspective, and for a lot of us thinking about the research that we're doing, who are key people that you want to connect with after this to start thinking about that system level change or policy level change?
Right. And so for me personally, I think there's power in numbers. And so sometimes doing a bottom-up approach is the most effective in making people at least angry enough about something that they might call into their MLA and try to, enforce change from the bottom up. And so I still really strongly believe in community engaged advocacy and building strength in people's direct environments and living worlds, if you will. And so that isn't always the fastest way to go. But I do think that while building that momentum from the bottom up, you're also potentially already providing a stronger network of support so that even if system level change is slower, it helps create networks of resiliency at the foundation. And sometimes that is because neighbors, the people that you directly engage with, only see you at your best when you're outside of the home. And sometimes it's about creating knowledge systems where your neighbors, the people in your direct environment, understand the impact of multiple levels of society's idea about disability impacting your way to navigate that society. And so sometimes it's about maybe shaking up the people closest to you and kind of helping people understand from the bottom up where systems are hostile to the people that are not, the most productive or that are not maybe the future leaders of the country, and how everybody matters and how to also shifts people idea around what it means to be a person with disability.
Fantastic. Thank you so much, Laura. Appreciate that reflection. I don't know if any of the other fellows wanted to comment on that. I know we also have quite a few questions coming in the chat, so I don't know if we want to move along or if you wanted to just quickly share something.
I might be able to, Vanessa, pair. I don't want to jump out of queue, but I was reviewing some of the questions, and I might be able to speak to Ray's question a little bit with my response to build off of what Laura was saying. I think even just leaning on what Sarah had presented in terms of the mapping, we know things are fragmented, and it's hard to know the channels to make inroads that way. And so I feel like one of the things that we need to lean on when we think about moving policy, like implementing policy, is established relationship and also trust. And I think it's for me thinking about who do I know who kind of move within my orbit, who maybe has some of this established relationship and inroads with decision makers or what have you, who I have a relationship with, maybe they have some trust with me. And so maybe will bring me along to some of those discussions, some of those making some warm introductions that way. So Ray, to your point, in terms of like, how do I advocate or move those things forward? I really do think relationship is a huge component of that, and being aware of what maybe even those relationship maps look like within your network as perhaps a channel of implementation.
Fantastic. I love that. Thank you. I wanted to direct to a question in the Q&A. So great presentations. Could you reflect on what the importance is of an implementation lens in a policy context? We don't tend to talk about implementation when talking about policy. Great question.
Can I share just one reflection in response to that question is, I think when we think about an implementation lens in a policy context, I hear that as something that's embedded in the work that we're doing from the get-go, like right from the beginning, thinking about the like goal of implementation and having that as a guiding lens from the start of the work that you're doing. I think then lends itself to thinking about some of those considerations around feasibility, practicality, some of those pieces that are really important that when you come to the other side of, say, a policy-oriented research project, you want those outputs to have those considerations embedded, I think, than to have a greater chance of being implemented and moving toward practice. So when I think about that pairing of implementation and policy work, I see it as being really important to be embedded with each other.
Beautiful. Yeah, it's interesting because sometimes we think about things will get into policy, and that's often a goal, and it's amazing and very celebrated. But just because it's in policy doesn't mean it's actually being implemented. And so thinking about how we can better connect that when informing policy. Sorry, Sarah, I saw you unmuted.
No, that's okay. I can definitely just talk a little bit about, because I wear both hats, both working as a scientific researcher and then, of course, on the policy side of things with the Government of Canada. And it's something that I've learned just through my experiences, especially that implementation piece, is that while outcomes are extremely important, when we're trying to do that implementation into policy, it often starts with understanding how programs and systems are organized and kind of where those gaps exist. And from the policy side of things, I think like policymakers and decision makers often need a clear picture of how systems are set up before they can even consider those changes. And another key consideration as well is like how that research is translated. So I find that research and evidence is more likely to be implemented or shape that policy when it's communicated clearly. So policymakers love visuals, things that are plain language, concrete policy questions, rather than some of our research, which can be quite technical or an academic report. And so if we are able to actually take some of that evidence and that work and engage it, it would be more easy to apply. And then I think that also an important piece of that is that lived experience needs to be understood as an implementation evidence itself, especially like the lived experiences of people navigating some of those systems and outlining where those policies break down in real life. And so I think when we're trying to focus on the implementation side of things, bridging research and policy into implementation is more about meeting both worlds where they are, while keeping that lived experience kind of at the center of it.
Amazing. Thank you, Sarah. Brilliant reflections and questions. And thank you, everyone. I see we're at time, so I want to respect people's hour. But thank you again to the fantastic fellows. Thank you, Brittany, for helping to facilitate today. And thank you all of you for being here to participate, to listen, to ask your fantastic questions. From my perspective, it was so interesting to learn about the work that you're doing through the Advanced Network. I've heard about it, I know of it, but didn't know those details. And so definitely looking forward to hearing how your projects evolve and the amazing work that you continue to do. So thank you, everyone. And again, thank you to our attendees for being here. Apologies for the glitch. Gotta get my laptop checked out. But thank you, everyone. And we will be following up with a feedback survey. If you could share any feedback, we're always looking for ways to improve and enhance these webinars. One being probably my laptop. So thanks. Thank you, everyone. Have a fantastic rest of your day.
Thank you so much, everybody.
And thanks for that article, Ray. I'm going to check that out. Bye.
Thanks, Vanessa. That was so great.